everyone, and welcome to today's webinar on the 2015 SOAR Outcomes and SOAR Superstars. The webinar is presented by the SAMHSA SOAR Technical Assistance Center at Policy Research Associates under contract to the Substance Abuse and Mental Health Services Administration of the U.S. Department of Health and Human Services. My name is Kristen Looper, Project Director of the SOAR TA Center, and I'll be moderating today's event. Housekeeping items before we begin. This webinar is being recorded and will be available for download on the SOAR website in about a week. Your lines will be muted throughout the webinar. Right now, you can download the PowerPoint slides to view following the webinar. If you look to the top of your screen, you can go to File, Save, Document to download the materials. You can also access the file by following the link to the SOAR website at the bottom of this slide. With a welcome from Dr. Pamela J. Fisher, Social Science Analyst at the Homeless Programs Branch for the Center for Mental Health Services at SAMHSA. I will then provide a brief overview of the national 2015 SOAR outcomes and introduce our superstar states. You'll then hear tales from the top 10 from Ambrosia Crump, the SOAR State Team Lead from Nevada. You'll hear about consistent progress in Virginia from Latasha Howlett, the State Team Lead in Virginia. And then Fred Morton, the SOAR State Team Lead in Connecticut, will talk about making improvements towards success. And with plenty of time for questions and answers. Introduce Dr. Pamela J. Fisher. Dr. Fisher is the Federal Project Officer for SOAR and will share a few words of welcome.
Kristen, I want to begin by thanking you and all of your team for the really stellar work you do. And everybody that's on this webinar today, and to all of the little things the TA Center folk do. I want everybody that's toiling in the field. This is my favorite webinar of the year, I think, because this is the occasion on all of you get to bask in the glory of your accomplishments, which this year really impressive. So I think that it's really remarkable that 6% on average or all of the applications are reviewed at the initial application. The full time for getting these applications has dropped 13 days and is now only 81 days on average. I think that it's very impressive to see the kinds of differences this makes for individuals, that they now have income and access to insurance, real gateways for them to get into housing, to get health care, and really start their road to recovery. But it also gives enormous benefits to communities. For example, around $275 million has been put back into local economies. That during the presentation of the findings today, accomplishments of SOAR, Chris, I hope you're going to be talking about the efforts you're making to with new populations or to continue work with populations such as veterans and transition age youth, and also to talk about some of the work you're doing with hospitals and jails and so forth, which is very, very impressive and is to make a huge difference to people's lives. So also looking forward to hearing the states talk about their own accomplishments, how they got into those top 10 categories, how they've maintained their permits at the consistently high levels, and what ways you found of making improvements in your applications. So I'll turn this back over to you, Kristen, and thanks again, everybody, for all your work.
Thank you, Pam. Yes, we're definitely going to be covering those awesome accomplishments. So thank you for, I think All right, Kim, thanks for all of the incredible work that you all do in the field. These outcomes really represent the hard work that you're put in and day out, and we are really excited to be able to celebrate these successes with you. We only ask you to formally report these quantitative outcomes once a year, but we hope that you'll continue to share your stories throughout the year. We'd love to share individual success stories in the e-newsletter and on the SOAR Voices blog, and it really demonstrates the impact that you're making in people's lives through outcomes. And it's also, key to supporting and expanding your programs. And sharing these stories is also important in sustaining ourselves in the work and knowing that we're making an impact. Hearing these individual stories of transformation really validates, why we put in the long hours. Thank you. So here are the numbers. So from July 1st, 2014 to June 30th, 2015, SOAR providers helped 3,971 people experiencing our risk of homelessness get approved for SSI or SSDI on their initial application. There were additional 698 approvals on appeal. So, decisions on SOAR-assisted initial applications were received in an average of 81 days in 2015, which is a decrease of 13 days from 2014. It's incredible. And the average days to decision on appeal was only 1 day more, 82 days, which was a 37-day decrease over 2014. So, excellent. Cumulatively, SOAR providers have served over 50,000 individuals. 65% of initial applications have been approved nationally, and when you combine the 27,226 initial application approvals with the 4,021 approvals on appeal, there are 31,248, let me say that again, 31,248 individuals that have gained access to Social Security benefits with the help of SOAR. Those are the national numbers, and they're huge and they're wonderful. But now let's take a look at our top 10. So inclusion in the top 10 is based on reporting outcomes in 2015, reporting at least 100 cumulative decisions, and then the 10 are ranked in order to highest approval rate. And here they are. Our top 10 states in order of approval rate is Pennsylvania with 95% of 1,706 applications, Tennessee with 92% of 1,449 applications, Maryland with 85% of 690, North Carolina with 81% of 1,446, and Arkansas with 80% of 761. So detail of the top 5, Kansas, Rhode Island, Alabama, Oregon, and Nevada all also have approval rates in the 70s on hundreds of applications. So these 10 states, they have an average approval rate of 84% for 8,893 applications. So they're not only submitting successful applications, but they're able to do it over and over and over again, tons of times. To compare, based on the most recent data that's available from SSA, the national approval rate for all SI applications at the initial level is 28%. And so the national average for all SOAR approvals has more than doubled that rate and is 65%. And like you just heard, our top 10 states are currently averaging at 84%. So later on this call about the things you can do to kind of help rise to the top of the pack. Your state be top 10 next year? Highlight those states that have consistently been able to assist with over 100 decisions every year for the last 3 years. You'll notice that the states in blue are also represented in our top 10 for approval rates. So it's not quality over quantity, it's quality and quantity. So way to go, Arkansas, Florida, Maryland, Michigan, Nebraska, North Carolina, Ohio, Oregon, Pennsylvania, Tennessee, and Virginia for doing a wonderful job. Not only have you more than doubled approval rates over the national average, you're also efficient and effective. So like I said, SOAR applications are approved in an average of 81 days, compared to national average processing time that is closer to 110 or more days. It's important to note that by getting applications approved at the initial level, we're avoiding appeals, which currently take, on average, 15 months. So you're saving processing time and money, getting people the income they need right away. So I want to give a shout out to states that have the most improved capacity. Alabama, the District of Columbia, Georgia, Kansas, New York, and Rhode Island showed the most improvement in total decisions in 2015 from what they reported in 2014. Collectively, these 6 states went from 250 applications in a year to 1,318 applications in 2015. So it's heard that the national average days decision went down 13 days, but 12 states in particular showed incredible reductions in their average days to decision. So Alabama, Alaska, Iowa, Kansas, Kentucky, Louisiana, Massachusetts, Minnesota, Missouri, Nevada, Tennessee, and Virginia went from an average of 129 days to decision in 2014 to 90 days in 2015. So collectively, that's a reduction of 39 days. So that's a month. Incredible work. We know how important quality review is and work hard to get as many eligible applicants approved as quickly as possible. And these states made particular effort and strides last year, improving their approval rates. So Alaska, Arkansas, Connecticut, Massachusetts, Nevada, New Mexico, Vermont, and West Virginia showed the most improvement in their approval rates from 2014 to 2015. So collectively, these 8 states increased their average approval rate from 62% to 85%. So that is from below the national average to over the top 10 average, which is quite a significant feat. We congratulate those states who made the improvements. The impact that we're having on individual lives and on states and local economies by bringing money into those communities. So we know that in 2015 alone, SOAR-related SSI and SSDI brought approximately $275 million into the economies of the 44 participating states and District of Columbia. We had states that tracked and reported on Medicaid reimbursements that totaled $1.32 million, which was an average of $6,400 reimbursed per approved application. So a great return. State reported public assistance reimbursement by SSA showed an average of $2,218 per approved application. We also received reports on retroactive benefits, 462 approvals that totaled $3.6 million. So it's a long way in helping transitions to housing and long-term stability. These reimbursements and the increased income is making a really significant impact, especially on sustainability efforts. Special populations. The past year saw incredible progress and advancement in our work with veterans. We've been working closely with veterans and state and local veteran initiatives to ensure that veterans who are eligible for SSA benefits are able to apply. So 32 states reported to us last year that they assisted over 300 veterans with their disability applications. And currently, more than half of the 380 Supportive Services for Veteran Families, or SSVF, grantees report using SOAR. Where SSF grantees become local leaders in their communities, dedicating SOAR benefit specialists on their teams, and really investing in this work to increase income for the veterans they serve. Recently concluded a one-year pilot with federal VA staff at 4 VA medical centers. It was very successful, and that work resulted in the creation of a VA guide for federal VA staff called SOARks to End Veteran Homelessness, VA's Workers Guide. This guide helps open up a lot of opportunities to increase capacity for assisting veterans within the VA with SOAR applications. to see continued interest in collaborations with corrections and work with justice-involved persons. We are seeing more and more in-reach to local jails and a coordination with parole and probation to coordinate services. We see SOAR getting incorporated into jail diversion programs and pre-release planning in state prisons. The correction are training staff on the SOAR process to help ensure that pre-release preparations include access to income and health insurance for those who are eligible. These collaborations have been great, but they aren't always easy. And we're looking at different systems that operate in unique and complicated ways, and change can be difficult. Our mantra continues to be decision before discharge, and we know that hard work and careful planning can make that happen. So who are aged 18 to 24 can face particular challenges when applying for SSA disability benefits. Members of this age group are often too old child services. They may not be ready for adult services. However, many SOAR providers are seeing great success in serving this special population. So 21 states who are working with transition age youth, and they reported 171 applicants in this special group, and achieved an 81% approval rate for those applications in an average of 81 days. They also did reconsiderations with a 70% approval rate in 71 days. So outcomes really dispel the myth that it is more difficult to get approvals with this age group because we're seeing approval rates for them than we do overall nationally. And the exciting thing to us is of those youth who were approved, 57% were also working post-approval. We know that employment is important and is a reality for these youth, which is an incredible way to increase their income and connection to their communities. Related to that, and we know that employment is really beneficial to people with disabilities as the benefits of work go far beyond the monetary gains that people see. So people seeking or receiving SSA benefits are encouraged to work or seek employment, either independently or with the help of professional support, like supported employment programs. So despite those myths about working while applying, we did hear from 20 states that about 25% of their almost 2,000 applicants were working during the application process. And the exciting news is that of the 16 states that reported, nearly 50% of the applicants they were serving were working post-approval. So there is a lot of work going on. We're excited to see more and more of that and support the increase of that. In 2015, there were 19 states that reported that they were successful in securing new or sustaining funding for their SOAR programs. It resulted in the creation or continuation of nearly 60 full-time SOAR benefit specialist positions and 2 SOAR coordinator positions. This funding came from a variety of sources, including SAMHSA PATH and CABI grants, foundations, universities, and hospitals. We want to with you all more about the specifics of those and help you get connected if you're not represented in those numbers. A lot of wonderful collaborations built from SOAR programs. One of those collaborations that we've had over the years is with the PATH program. And you are familiar, SAMHSA funds a program called Projects for Assistance in Transition from Homelessness, and this funding is available to all 50 states and the territories. And almost all states have trained PATH providers on the SOAR model, but some states have gone above and beyond and dedicated benefit specialists on PATH teams and required that SOAR applications be a part of their contracts with PATH providers. It's really making a big difference in the number of applications being in those states, as well as the collection of outcomes. So caseworkers really get credit for their work. Many of the state PATH contact service SOAR coordinators and the others are very supportive of SOAR efforts. So we've built over the last couple of years to see increased SOAR collaborations with SAMHSA's cooperative agreements to benefit homeless individuals, or CABI, grants. Many states are using CABI grant funds to dedicate SOAR positions, and others are using CABI for training and expansion efforts. So you'll have that from a couple of our presenters in a few minutes or just now. So without ado, I am now honored to turn it over to our superstars, who will tell you more about how they've been able to make it all happen. So we'll hear first from Ambrosia Crump, the Nevada SOAR coordinator.
Everyone. Hi, afternoon, everyone. My name is, as Kristen mentioned, I'm the Nevada SOAR coordinator. We received some funding at the state level for CABI, and our was a sub-recipient of that grant, so I'm able to act as our SOAR coordinator on a full-time basis here. About where we are coming from here in Nevada, we have actually been one of the first states to participate in the SOAR model. We've been around since 2005 as SOAR state, and since 2005, as of 2014, our cumulative rate of approval for our initial claims were 71%. We did really well with our approval rating. As you can see, our initial approvals for the 2014 year alone were 85%, but we weren't really good at our volume of claims. We had, at that point, dedicated staff. Our SOAR state team lead was our Southern Nevada COC coordinator, and as you know, COC coordinators tend to wear a lot of hats, and so we didn't have anyone dedicated specifically to SOAR to manage the program. We were able to train over 500 people across the state of Nevada in the SOAR model using the two-day format and also engaging them in the online training. And once we were able to review our training logs and figure out who was still practicing in our state or who was still active in the community, we were able to determine that roughly 220 people were still in the community in Nevada who were SOAR trained. So these are some of the things that contributed to our improvement statewide. I'm on board as of January 2015 as a SOAR coordinator, and that was, again, as I mentioned earlier, through CABI funding that our state was able to secure, and we were the sub-recipient of that. A lot of the work that I initially did was to engage the people who are already practicing across our state. Our state has a unique circumstance of having a very concentrated population in the Southern Nevada area, and with the rest of our state being mostly rural. So we're a large state, but most of our population is in Southern Nevada. So we know that people have been trained, especially in those other areas as well, but they were exercising independently in those pockets of the state. So we had to re-engage them and see where they were and how they were using the SOAR principles were taught in the past. And we threw a newsletter, which I'll show you guys in a second. Also, what we were able to do was we were able to re-engage people through refresher training. So if they were in those circumstances where they were not connected to anybody practice-wise in their communities, and it's been some time since they've had that training experience. On average, it's been about 2 or 3 years for a lot of those individuals. We were able to provide some refresher training around the SOAR fundamentals and expectations for data collection and to report outcomes. In addition to that, we were able to start our SOAR fundamentals statewide. So I was able to travel to Northern Nevada and provide our ABI recipients as well as the local community members with the SOAR fundamentals training for those who have engaged in our online course. And we were able also to do that in Southern Nevada as well. And as I mentioned, with that training, what we did is we simulated the process to record the data into HMIS, which is a tool that we're currently using statewide for data collection around SOAR and other agendas in our state. So we're able to work with our HMIS provider in developing the script in the system to record data, and then once people trained in the process, they were given the profile-enabled ability to record that data for us so that we could report that. So the screenshot of this newsletter, it actually was sent out statewide. It went to not only those who are trained in the SOAR model, but it went to the COC coordinators so they can distribute the information across COC members, because we have 3 continuum of care in Nevada. SSCS, once we were able to connect with them and get their information, we could share this information with them as well, and any supervisory staff who were potentially interested in having their newly on board staff trained in the SOAR model. So we were seeking to just do a lot of engagement and sharing of information across the state. And so a lot of what we were recording here just was information on what upcoming training opportunities were available, SOAR webinars with PRA, and also how to report outcomes. And so it's maybe hard to see in a screenshot, but there's a download available for you guys to see a sample of this newsletter that we used. And on this shot, you might be able to see that we mentioned that the SOAR data form, I was able to link it so people could download it right from where they were. So even if they were rural Nevada, they could access the data form, submit it to me via email or fax, or if they were HMIS users, they could enter that data into HMIS. So they kind of came on board as of January 5th, 2015. A lot of initial work was around re-engaging our community leaders and those who were previously trained so that we can get the information that we needed from them. And what we really found was that a lot of our community members were practicing SOAR, but we just weren't aware of that because they reported to us that they weren't really clear on the outcome reporting requirements or responsibilities around their work. So what we found is that a lot of our practitioners were doing great work in our community. We just weren't aware of it. And as we know, a lot of our opportunities are driven based upon the data that we're able to collect and report on. So this was just a great news for our state to know that people were practicing and using what we've taught them in the past. And now we know where they are and who they are, we can get the data that we need to report. I did some Nevada-specific training based on how to, actually based on not only the way we practice SOAR here in Nevada and how to submit SOAR referrals, but also how to report outcomes for those who are practicing. I worked with our HMIS contractor on setting a process for us to record that data that we needed, that not only was Policy Research Associates interested in, but what we were interested in knowing as a community around the clients that we're serving using this model. So we found that to be a really streamlined process just for us personally because a lot of our providers are already required to utilize HIS. So for us personally in our state, this seemed to be a good fit. And we also host a statewide SOAR forum. So we reached out to people, not only our COC providers, but also stakeholders who touch the population that we traditionally serve with the SOAR model, whether those are mental health and medical providers, the criminal justice system, our legal aid centers who may be serving as advocates to this population. We reached out to all the stakeholders who we thought would be interested in learning more about what we were trying to do in our state, and so we were privileged to have PRA come out and facilitate that forum for us. And just recently in December, we were able to start our first pilot. In the past, Nevada has not had the opportunity to work with our local Social Security offices in the traditional SOAR sense to where practitioners could submit a SOAR claim packet in its entirety, have the relationship built in with the local offices at that point. So practitioners would have had to use the traditional process to apply for Social Security, and their intervention mainly took place at the DDS level. And our DDS has been great. They've been great partners. They participate in all of our trainings, and they are actively involved in supportive of SOAR. But what's been happening recently is, and I think in large part due to the engagement efforts in the forum we hosted recently, because they were invited, SSA was invited as well, the local office administration, is that they are now interested in allowing us to pilot utilizing SOAR the way it was designed to be used. Is really excited about some of the outcomes that may potentially seeing in our 16 numbers due to this, just a higher level of access to the Social Security Administration. So I did want to talk about where we are now. As a state, we did significantly improve our initial approval rate, so we are approximately at 94%. We reduced our days to decision by almost 80 days, or I think around 80 days, so we're at 107 days. And we now have partnered with organizers who are willing to set aside dedicated staff to practice in Las Vegas in the community using the pilot. So we're really excited about that. One of them is a nonprofit outreach team who's really committed to doing this work for the population they're already working with now. And the other two staff are going to be with a mental health, behavioral health agency. And then the local Southern Nevada VA also set aside a part-time social work staff to do that for their SVF and HUD-VASH clients. So we're really excited about the new partnerships that we are building here. In addition to that, we just sent some local leads that were identified by their respective COCs to the most recent Leadership Academy, or one of the most recent, in New Orleans in December. So we're excited to have them engage in training across the state as well for the opportunities that I can't go out and do the training myself. We're really excited about the progress we've made just in a year's time alone, and we really attribute that to the fact that we had staff set aside to work on the project itself. I think that really was critical for our particular state, especially due to our unique needs here. And so I need to take questions at a later point. I do have to leave the call due to a prior obligation, so I will be leaving the call. If there are questions specific to Nevada, I'd be happy to follow up with someone at a later point. Thank you.
Thanks, Roja. That is absolutely incredible progress in only 1 year. And thank you so much for all of the hard work that you put into it and making that happen. So, yes, definitely, if there are Nevada-related questions, we'll get them forwarded on to Ambrosia and get those answers back to you. I'd like to now introduce Latasha Howlett, the SOAR State Team Lead with the Virginia Department of Behavioral Health and Developmental Services.
Hello, everyone. Well, on this rainy Wednesday afternoon, I'd like to talk a little bit about in Virginia and how we're to consistently present that are in with the national averages. So I'm an overview of where we were last year in 2014. As opposed to 2015. But in 2014, we had a total of 206 applications completed, and we usually have about 100 or more active SOAR workers across the state. Sometimes that number does vary, but it usually stays around 100. Awesome. We had a 72% approval rate in 2014, and like many states, we don't have direct funding for SOAR, but we have been able to use CABI grant funds and past funds to help promote SOAR efforts across the state. It's been really wonderful. I've had other communities that are looking at other creative avenues in which to fund activities, such as using more funds and private donations in order to create a full-time SOAR application, a full-time SOAR person to do applications for that community. So I'm really looking to see what they do as far as that goes. So that's in the works. And, as Chris mentioned earlier, a lot of our work is about not just getting people benefits, but actually helping them to promote recovery. So in 2014, we had 105 people that housed as a result of our SOAR efforts. So it's nice to see people off the streets and getting stable as a result of the work that the people do across the state of Virginia. Compare 2014 to 2015. 2015, we had some staff, we had a lot of major people that were really advocates of SOAR go on to other agencies and take on other responsibilities. So last year we had 182 initial SOAR applications completed, and 124 of those were approved on initial application. I think it's important to mention that even though we had less applications done in 2015, our denial rate didn't change much. We only had one more denial of applications if you look at the year between 2014 and 2015. So the work is still being done in equality, and I really am thankful for a SOAR worker in the state of Virginia that does these applications. We had state approval rate in 2015, and then our decision rate changed by 39 days. We had a 39-day decrease in number of days processed for our decisions, and that's wonderful. I know people work really hard and they really try to get everything together in order to get applications in Social Security as soon as possible. And then I like the DDS. Social Security also understands the importance of getting applications adjudicated as soon as possible. And we had 93 people housed through our efforts. So again, that's 93 people that won't be on the streets as a result of what situation that they're facing. So that was wonderful. And what we do here is we do a four-pronged approach. To Nevada, we've been doing SOAR activities since 2005. I came on board in 2011. I'm familiar with the PATH program and PATH process because I came from a PATH program as a SOAR worker. But our process is planning, collaboration, continuation, and modification. We're thinking about expanding SOAR into a new community in Virginia. We do a lot of planning. I meet with the local COC leaders. I meet with local leaders and management of particular agencies that are looking to have staff trained. We develop a plan. We know who's going to do what. We already know before the training starts what the program will look like or what that will look like for that community. So it's nothing that surprise. Training comes at the end of a lot of planning. Collaboration is with us collaborating as a community. I know that this process requires a lot of collaboration, but we collaborate with just the community providers and the community leaders. We also collaborate very closely with Social Security Administration and Disability Determination Services. They are our right arms. We have a very good working relationship with these organizations. They come to the trainings. They come to the meetings. They are an integral part of this whole process. They understand what our process will look like. They help develop the local processes because each process looks a little different depending on which community we're talking about. But we have to make sure that our program and our process looks is individualized depending on the needs of that community. So some social offices have one requirement, other ones have another one, but we try our best to accommodate that because we have this collaborative relationship. The action piece has to deal with how regularly we meet and we contact with each other. So once a SOAR community comes on board, it's not just left us on to try to figure out how this should work and what things need to look like. I actually meet with them on a quarterly basis. Social Security is at this meeting. DDS is at this meeting. We troubleshoot. We ideas on how to best serve the population that we're trying to serve. So this is what we do. We're always trying to find out how we can best do these applications, how we can best make sure that we're the most effective. So there's a lot of evaluation of meetings and on all those things. The vacation piece comes in that once we realize things that aren't working, we change them. No black and white way to do this. What works one day may not work the next day. So we spend a lot of time during this continuation meetings, during our quarterly steering meetings, talking about, okay, well, what doesn't work and how can we change that? So we spend a lot of time trying to modify things and adjust things so all parties are happy. So at the end of the day, for me, I need Social Security, I need DDS, I need my SOAR workers, and I need my SOAR workers agencies to all be happy. So there's a lot of modification that goes on, and thankfully it does work for us. And so I wanted to highlight was just the collaboration we have with our local Social Security and DDS offices here. They regularly provide service trainings for our SOAR workers, and just some of the different ones we've had over the years. We've had one, best practices for completing DDS and SSA forms. So these forms are not the traditional SSI application or SSDI application or even the 3368 form. These are seizure documentation, pain documentation, how to fill out the work history form correctly in such a way that it really helps DDS. We've had them talk about the Social Security drug and addiction and alcoholism policy. They actually took that piece of legislation and broke it down step by step for us and gave us verbiage that we need to use in order to explain that. That was an awesome service that they provided. One on how to best present for hearings at the ALJ level, helpful. Sometimes it's hard for us to have people with the type of help they need when they get to that ALJ level. They gave us some tools that we can use to help our clients at that level. And then finally, we have also done a work incentives in service where, because we're really in support of people working. So we don't want people just to just have fits and not necessarily look at employment options. So that was really nice when they went ahead and gave us the in-service on work incentives. So that was just some of the things that they do with us. And so I'll be on the full call, and I'll be happy to take them. Thank you.
Tasha, it's incredible what you're doing in Virginia and consistently doing. We've learned a lot. Can't wait to hear more. All right, last but not least, we're going to hear from Fred Morton, the SOAR State Team Lead and Behavioral Health Program Manager with Housing and Homeless Services at the Connecticut Department of Mental Health and Addiction Services. But before Fred begins, I want to give recognition to and express our appreciation for the efforts of Alice Minervino. Alice was the Connecticut SOAR State Team Lead for approximately 8 years. And over those years, Connecticut has maintained a good approval rate. They consistently collect data, and they've worked really hard to have dedicated SOAR staff in all major areas of the state to better serve applicants. And Alice was really instrumental in that success. She recently turned over the helm to the very capable hands of Fred, who will tell us about how they've been doing it.
Thank you again, Kristen, and everyone for allowing me to present. I'm pretty new to this role, as Kristen had said, and I have big shoes to fill in Alice, and she's done a wonderful job, and she's always been an inspiration for me, and I've worked with her for many years in a variety of different programs, and she's just done a wonderful job, and actually she supported me some years ago, about 6 or 7 years ago, when I was a member of the COC team in Waterbury, who implemented SOAR case management in Waterbury, Connecticut, which is a very needy community, that the individual is still working there and doing very well. And so again, it's just all appreciation to Alice, and I have big shoes to fill. So moving forward and looking at making improvements, I think one thing that we have done is we've incorporated SOAR into new initiatives. And case in point is our Connecticut CABI grant. And in the CABI grant, we use critical time intervention to work with folks who are homeless. And one huge part of that is SOAR case management. So we connect individuals to SOAR trained persons in their community. And it helps folks to maintain housing and employment and other services to progress into recovery and improve the quality of their lives. So we've been doing that with CABI grants. We also a forensic services division also has dedicated at this point. We're working on getting the person implemented and connected to our communities. A SOAR case manager to work with folks who are involved with the criminal justice system in a variety of settings, either folks who are coming out of Department of Correction, folks who have a lot of interaction with the judicial branch, and other folks who are served by a forensic services division who would meet SOAR eligibility. So I'm going to be working with the folks in that division to connect that individual and that provider to the local community efforts that we're doing. In Connecticut, when I was trained in SOAR many years ago, it was a full-day training, and so what we've done this move forward is we have folks complete the online course, and then we follow up with an intensive half-day training with our state expert here. The folks in New Haven, Columbus House, and New Reach, they really Sam Libby Proxman down there have done a tremendous job in SOAR. And so what we do is we ask them, they come up and they that course. And then we look at the outcomes, tracking and reporting. I think we're going to be looking over the next year about how to reflect back to communities so that they can use some of their outcomes in on a real-time basis. But again, that's something that we're going to discuss. Regional collaborations. We have great regional collaborations in New Haven, Hartford area, in Bridgeport. Folks who really have come to the table and they provided leadership to implement SOAR in their local communities. And I think what we're going to be doing moving forward is is gathering additional feedback, as we have been all along, but gathering feedback from local groups, what's working for them, what sort of quality improvement initiatives or measures have they put in place, and then also to identify how we as the state could support those efforts. Are there also statewide policy changes or things that we can do to help further facilitate and support our local community collaborations and the SOAR case managers there? Again, quality improvement, looking at facilitating information sharing, giving opportunities for folks to get together. I mean, we're lucky that we have a small state and folks can actually drive to the center of the state within an hour and a half at the most. And how can we get people to talk and to share information and ideas, and also to identify quality improvement approaches that the local collaborations are taking, other states are taking, and kind of try to implement those locally, and also to share successes too, where we're going to work with Poly Research to kind of participate in public relations and other materials that we could present to our policymakers and our leaders here in the state government. And so what we're going to be doing, so I think the next year we're going to kind of reflect back, see what's really worked, and ramp that up, and then look at other ways how moving forward as this initiative has matured, how can we support those? The local collaborations, how can we involve providers who may not be involved with local collaborations as well?
Fred, I will finish, or did you have just one more slide?
No, I think I'm done. Oh, no, I'm sorry. I couldn't go forward. And another thing that we also, like with Virginia and Nevada, we're also encouraging employment. And how can we see SOAR, we see benefits as kind of a foundation for folks to either part-time employment or other or full-time employment, so that they can add income and a higher quality of life. Housing in Connecticut is extremely expensive, and folks who get SSI, SSDI, really it's extremely difficult for them to find quality housing, even if they're in supportive housing. So again, that's something that we're going to encourage, working with our supported employment providers, with our Bureau of Rehab Services, vocational services here as well, to kind of get people up into exploring what they want to do with their lives and what they would like to do with employment, particularly the young adults, as what we talked about before. So.
You to miss out on that, because we're really proud of and love to share about the great kind of employment connections that you guys have in Connecticut. So, all right. So, encourage all of you to keep up the great work. We can't wait to hear about what all the rest of you have been accomplishing this year, and can't wait till our 2016 outcomes. We know that you are transforming lives, one application at a time. That Super SOAR says that you are a SOAR superstar. So we now have time to open the floor for questions or comments. There are two ways to ask our panelists a question. You type your question into the Q&A panel, which is located underneath the participant tab. I know some of you have already found that. We have a couple of questions in the queue. Or if you want to ask a question by phone, you can raise your hand by clicking the hand icon, which is in the participant pod. And we can unmute you individually so you can ask your question verbally if you would like. So question we've got here. queued up. All right, we have a question from Gary Nash, and I think this one was for Latasha, and it was about the 2 government agencies that you were working with regarding collaboration. I'm unmuted now, Latasha.
Oh, okay. I'm sorry.
Okay.
Security Administration and DS.
Okay, Susan, I didn't want to answer for you. So SSA and DS of key agencies. Thanks.
Yes.
All right. So the next question, Latasha, is also for you, and this is from Michelle Baxter. She was really impressed with the training materials and stuff that you got from Social Security, and was wondering if they could get some samples of those materials that were supplied by SSA.
I have hard copies. I don't have electronic copies, but if there's a way we can facilitate that, no problem.
So how about this? We'll talk offline about how we get some electronic versions of those, and then Michelle, we'll make sure that we get them your way, and we can actually, once we get them, we can post them on this webinar page as well. So in case there's anyone else listening who is also interested, they'll be on the SOAR website on the page associated with this webinar.
Okay.
All right. Question here. It's a question related to PATH and CABI and differences there. So the question was, so CABI is a position included by the PATH grant in regards to SOAR. And actually, just to clarify a little bit, so the 2 programs are separate grant programs, so they're not integrated together. Sometimes they partner together, but they're separate grants. And there are some PATH grantees that are using PATH funds to fund SOAR positions or part-time SOAR positions or getting SOAR training. And then with the CABI grant, there are some CABI grantees that are using money towards SOAR. So they're independent there. Question that came through, and I want to throw it out to our guests first, and then we can talk about it at the TA Center too. But the question is, what were some of the challenges with getting folks on board with the SOAR model? So we'll throw this out there to any of the panelists that wish to answer that.
Okay.
Yes, thanks.
This is an ongoing challenge for Virginia is people that are willing to commit the time to doing the applications. So while we have a robust number of active SOAR workers across the state, the amount of activity for those workers really it varies depending on management's perspective about SOAR. So I've had to educate management about the importance of allowing staff to have the time to do the application. You know, if you're doing them anyway, it behooves you to go ahead and allow your staff to do it in this way because it works for everyone. So one of our biggest challenges is just making sure that people understand the time commitment and that their management gives them ample time to do the applications.
I think also too the support from the medical community. So I know that there were some challenges early on with medical records, obtaining medical records from hospitals and other healthcare services, and I think that getting folks who psychiatrists, other folks to serve as kind of as consultants or to sign off on the application. That's something when I rolled it out several years ago that we dealt with. But again, we just built those communities or those collaborations, and we used our psychiatrist at our local mental health agency. And so again, that's we kind of pulled it together. But like Latasha said, is convincing the management that this is a worthwhile thing for everybody to work towards.
Great, thanks, guys. Right, the next question is related to SSA and DDS collaboration. And so we have a collaborative relationship with our local SSA office, and our identified liaison participates in our leadership committee. But they've recently started experiencing an increase in denials since there's the personnel change at the DDS level, and they're wondering how we can strengthen this. Well, first, if you have any suggestions about SSA or DDS, we can jump into.
See, we had similar to this, and but it was more of it wasn't across the state. It was a one community who didn't just having this problem. So I guess because we have such a good relationship across the board, in Virginia, we don't have a centralized DDS office. There are actually 5 offices in this area, and so so each of them work the same. When in dealing with SOAR, they work a little different, but because we have a good relationship with each office, we were able to have the office where we were having some difficulty, speakers that we were not having difficulty with, and then there was some type of understanding between those 2 offices in which they were more receptive to what we were trying to do. And we also had situations where the professional relations officers, I'm not sure if you guys are familiar with those, sat with our SOAR workers and actually went through cases case by case to talk about, things that may have been missing or why these cases were denied, because some of it was just things were just missing, and something was really a legitimate denial. So that's what we've done.
Excellent answer. That would have been my recommendation, is that, starting a conversation about the reasons for those denials and making, a stronger connection at DDS so that you can really, about that they are legitimate denials. Maybe there was something missing. Maybe there's a quality review issue. But what I will recommend is if for you ask the question, if you'll send us an email at the SOAR TA Center, either reach out to your liaison or our main email address, we can also talk really specifically with you about what that might be and help you make more connections if you need them. Right. I have another question about someone know Alaska's stats. I'm guessing you're in Alaska so that you can compare them to the national outcomes. So the 2015 outcome summary with state-by-state breakdown with 2015 numbers and cumulative numbers is going to be posted on the SOAR website and sent out on the listserv. So you'll have a complete document of that. And so we can get you that link and make sure that you can see exactly how you're doing compared to the rest of the state. All right, any other questions? I'm going to take no more in the chat box. It's now 4 o'clock. We can thank all of our panelists again, Ambrosia, Latasha, and Fred for talking about the great work that you've been doing, and another thank you to Pamela for all of your support, and to all of you out there in the SOAR community who are doing SOAR applications. We really appreciate your hard work, and we'll see you next year when we talk about our 2016 numbers. Keep up the work.